Hey, welcome back. This is Dr. Sigmund with Core Chiropractic in Memorial City, and we're here to talk about a very important joint in the body, and that is the shoulder joint. Now, there's a lot of things that can go on with the shoulder. You can have your classic sprain, strain. You can even have an issue where you end up tearing up some of the cartilage that supports the arm bone itself. It's called the labrum. But the most common thing that people come in with a lot of times is an issue with one of the rotator cuffs. Now, there are 4 rotator cuff muscles that help support the shoulder. There's one called the supraspinatus, which allows you to raise your arm. There's one that's called the infraspinatus, which allows you not only to raise your arm, but also to turn the arm out. There's a subscapularis. Now, that one allows your arm to turn in. And then there's a teres minor, which helps with also turning the shoulder out as well. Now, you can always have an issue where you can damage one of these rotator cuffs, whether it be from a slip, a fall on the outstretched arm. You can also have an issue where maybe you just sit at a computer all day, one shoulder sags down and starts to lean too far forward, and you can always have an issue where you compromise part of the shoulder. Now, in order to help the shoulder heal, there's a bunch of different exercises you can do. Some are very good and some not so great. So we're gonna go over the bad ones first. Now, the one thing that you don't wanna do to help out your shoulder is to do an overhead press with dumbbells. That puts a lot of pressure on the shoulder. You have tons of issues where you start to essentially fray and tear those rotator cuffs over time. The added weight to your shoulder going overhead is never really helpful. And also a big one too that people like to do is what's called the upright row. That's where they have the dumbbells in their hands or a barbell, and they work on just bringing the weight in front of their shoulders. What that happens is it actually causes the shoulders to round more forward. So as they're pulling up, they're actually leaning more forward. And it causes pressure inside the shoulders that can cause impingement, but also compromises the rotator cuffs. Also, one that people love to do that was really popular in the 80s and 90s when people would go to the gym was essentially the behind the neck pull down. That's when you see people at the gyms, they're pulling that cable. What they're doing is they're pulling it down, not in front of their body, but they're actually pulling it behind their neck. And what happened is it actually will cause the head to push more forward, puts more stress on the front of the shoulders. That can also cause a problem where you strain part of the shoulder or obviously one of the rotator cuffs. And the last one really that you don't want to do is doing bench dips. This is a bench dip means where you're on a bench, you have the arms behind you, and you're pulling your weight down and you're pushing yourself back up. Now the problem is that over time what people will do is as they go down, the shoulders do tend to rotate more forward. They're not putting the pressure on the triceps anymore, which is really what the bench dip is for. Is for the triceps, but a lot of times what happens is it really compromises the front of the shoulder, especially as the triceps get more tired. So the ones that you really want to focus on, the best ones that can help you out, not only with making sure that you don't have damage to rotator cuffs, but also help out with the posture for your shoulders, which is super important, is something as simple as a doorway stretch. So doorway stretch, you just find like a door jamb, doorway. You can hold on to a wall if you want to, making sure that your thumb is up or even pointing behind you. What you want to do is allow yourself to essentially get a nice static stretch at the shoulder height. Okay, find that door jamb, doorway, let that shoulder open up, even turn the head away if you want to for a little bit. But the thing is you have to hold that stretch for at least a minute and a half for it to be effective. You're stretching out not only the pec tendon, you're also helping out a little bit of the bicep, but you're also taking a lot of the pressure off of the shoulder. I usually recommend you doing it at shoulder height and also a little bit lower to help out with the bicep as well, because the bicep not only helps to bend the elbow, but also rotates the shoulder in. Stretching out both of those is super effective. Make sure you do the left side too. But the next one really is making sure that we do what's called a high to low row. And so what they'll do is they'll either take a cable on one machine to the gym, or you can do a resistance band. And what you'll do is you'll hold the cable in the hand on a handle, or you take the resistance band. And what you're gonna do is you're gonna start just above shoulder height, and essentially you're gonna pull backwards, just like this. As you go in that motion, it's almost like a slight decline down this way. What it's going to help to do is going to tell you, essentially not only stretch out part of the front of the shoulder, but it's also going to essentially strengthen the back of the deltoid right here, and also even part of the lat. What that's going to help you to do is to maintain the posture for that shoulder. Because what people don't realize is that when you're working those shoulders, is it's really important for you to work not only just the middle head, because the shoulder has 3 heads, the front, middle, and the back. That back one is the most important, because it helps essentially hold the shoulder into a better position. Super effective. You do it for both sides. Usually a good three sets of 10 is great, 2 sets of 15. Just make sure that it's slow and controlled. Also doing what we call reverse flies. This is where the resistance bands come in. They're really helpful. You can have the ones with the handles or just the band itself. What you can do is have the chest up, shoulders back. Take the resistance band in your hands. I want you to thumbs up. You're just gonna work on just bringing it back this way. You can call it the reverse fly. You can also call it a T. I prefer people to do the T's, slow and controlled. Hold it for a couple seconds, come back. You do even a Y pattern, coming back a little bit higher. Just making sure you don't bother your shoulder. But coming straight back across, more than effective. Holding for a few seconds, letting it go, and then coming back, reverse flies. Can help out to stretch the front part of the chest. Also can help to strengthen the rotator cuffs, as well as the muscles between your shoulder blades called the rhomboids to essentially help to accentuate the posture. The last one we're going to talk about is a lawnmower pull. Now, some people maybe not mow their lawns anymore, but back whenever people were having lawnmowers, what they do is there's a cable that you'd hold in your hand, and it had a little bit of handle, and you work on pulling the arm up and back. It was this essential maneuver, and people see it as a dance maneuver. You see people doing their lawnmower when they're on the dance floor, but not anymore. But that movement, you can do it with a dumbbell. You can also do it with a band if you want to. You get the step on the band or the dumbbell, and what you simply do is just make that up and back kind of motion. Okay, holding the dumbbell in your hand, nice, slow and controlled. Don't let your arm drag down. Just bring it up and back, nice and slow. Make sure you keep your head up the entire time. Left and right side, 3 sets of 10, 2 sets of 15. Slow and controlled. Make sure, obviously, it doesn't bother your shoulder, but making sure we target the back side of the shoulder, the lat, inside the shoulder blades, the rhomboids. All those are really effective. Make sure we accentuate the posture, make the shoulder blades pin back, make the rotator cuff stronger. That way we accentuate the posture, and we also lessen the chances of there being a rotator cuff injury in the future. But appreciate y'all sticking around. Make sure if you want any more helpful tips, you check back with us here at Chiropractic in Memorial City. Make an appointment if you have a shoulder issue, because we not only do we check out the spines, we also check out the issues with the joints as well. All right, I hope you all have a great day. See you on the next video.